Perfect. So just a little bit about me. As I just mentioned, my name is Yameen. I am currently finishing up my master's in health communication, and I kind of needed an internship role. So I went ahead and partnered with AMP. And then I started off as an intern, and then I moved into the position of a vaccine outreach coordinator. Because of this like influx and this need for vaccine confidence to combat the hesitancy we find in our community, I also think it was essential for us to, as community members to kind of take that lead and begin advocating for it so that our community doesn't fall behind. So I do enjoy working with a non-for-profit, and I also believe that's probably one of the reasons why you guys are also here as well. It's a great way to give back to your community, and this is a really meaningful effort. So some tasks that some tasks include, I create a vaccine digest. So I try to uplift like trusted voices and resources for people to kind of use as information when having conversations. So kind of articles or just feel-good stories around vaccine confidence. Another thing I do enjoy doing is I create social media posts centered around vaccine education. So you'll see I do post up a lot of graphics on the social media that you guys will of course have access to as well, that you can post as well for your communities. And so like another thing is we've been doing something called #ThisIsOurShot campaign. So what that basically is we have people share their personal narrative and story of how they got vaccinated. And this builds confidence because people begin seeing their own community members getting vaccinated. So this makes it easier for them to feel confident and comfortable in getting vaccinated as well. So another thing, so what we're trying to do right now is we are participating in the month of action. So this was something that the Biden administration has kind of reached out to other organizations. And we've been partnering with Made to Save and the US Department of Human and Health Services. And what we're doing is we're kind of aligning with Biden's idea that we need 70% of Americans vaccinated by July 4th. So it's an entire month just dedicated towards vaccine confidence, information, and just making sure people know how accessible it is. So this kind of stuff, it aligns with what we're doing here at AMP as well. And again, we're doing this to advocate for our community, and we want to give you guys the resources to have those conversations. So there's a lot that people are unaware of and afraid of. And we want to give you guys, again, the resources to have those conversations in an effective and efficient manner. So you want to build trust with the individual, and then this trust in our advocates is essentially going to give people the confidence to take the vaccine. So the important part is building trust and hearing them, giving a platform. And again, we have canvassing scripts, we have text banking and phone banking scripts as well that you guys can utilize to kind of guide these conversations. We also have a ton of like graphics that you guys can use. And if you guys have other ways of reaching out to community members, if you have like a social media or a digital day or whatever it may be, go ahead and reach out to me and let me know, hey, can you create a specific graphic geared towards my community? And I could go ahead and help you in doing so. So let's see. So yes, so some of the events we're going to be holding is the text banking or community canvassing. So what community canvassing is, basically you would want to be in a high traffic area or any kind of community event, and you want to be able to stop people and say, hey, have you gotten vaccinated? If they say, yes, I have gotten vaccinated, then that's the opportunity for you to use them to advocate for the cause as well. So say, since you're somebody who has gotten vaccinated, your narrative is going to go a long way in getting other people vaccinated. So it doesn't just stop at you. So you get those people to have those conversations and say, hey, can I get you to talk to 2 or 3 other people today and ask them if they've gotten vaccinated? And that question of have you gotten vaccinated or not opens up the platform for us to advocate. Another thing is that If they say, no, I have not gotten vaccinated, you can work through that conversation. We do have resources. We do have a lot of the statements that they're going to say. We have the facts to back up what they're going to say, or what you should be saying in response. So if they have a lot of questions, then there's a website you could send them over to. But again, if it's questions like, oh, is it haram, or is it this, or, you know, like, is it safe? These are questions that we do have answers prepared for you guys as well. So again, with the text banking and phone banking, we do not have a, we don't have like a specific contact list, but what we do have is you guys can use your contacts. You guys could use whatever, you know, sometimes people just pull out whoever's on their phone and they just text, you know, 3 contacts and say, hey, like, have you gotten vaccinated? If not, then, you know, you could follow the script that we give you. And, you know, that's another way you guys can have that conversation. So what I want to go ahead and do is I'm going to share my screen to show you guys the folder that you have access to. Okay. So over here, we have a couple different things that we want you guys to be using. So we have the vaccine outreach tally sheet. And what this basically is this keeps track of the conversations you're having. So this is going to include the date of outreach. And again, it doesn't have to be a full day of you putting in that work. What it would be is maybe even 30 minutes of a conversation or 20 minutes, and you're having that conversation, whether it's 1 or 2 or 3 people. You want to go ahead and state your information so that we can follow up with you. And then we also have the different modes of communication. So was it a call, was it a text, or were you just canvassing in an area? Another thing would be like, have you gotten this person, or how many people did you get to, you know, schedule a vaccine appointment? But what the most essential thing is, it's the number of conversations you have. So regardless of if the person signed up with you in that moment, you need to be focusing on the conversations that you're having, and if it's effective enough for people to even consider this. And then you could also just the number of events. So what's included in an event would be a phone, a text, a community canvas, something. If you guys or your organization utilizes Instagram or social media, any social media, Twitter, Facebook, you guys could have a poll. So you guys could have a poll that is dedicated towards like, oh, like, have you gotten vaccinated or not? And then when you see the responses to the no, you could reach out to those people as well. So that's a great way to utilize social media as a tool to have these conversations as well. And then the number of unvaccinated people. So again, like they said, there are going to be people who are like, oh, I'm already vaccinated, and then use them as a tool for advocacy, but also the number of people that are unvaccinated is something we're trying to keep track of as well. And then any highlights from the event. So any social media graphics you used or any tools that worked for you that we could share with other members as well. And then lastly would be the stories of the event. So if you had any amazing, incredible stories, so if you had a good one, a bad one, whatever it may be, if it's an experience that you want to share, we want to hear it. And we want to be able to say, hey, this is how it went. And we also want to give you guys a platform to share your narratives. So we have a couple other graphics. So over here we have the text graphic. This is something if you're going community canvassing, or if you just want to send this out to friends through social media or text messages, this is something that people don't know. So literally, in order to schedule a vaccine appointment, it's just a couple buttons. You need to text your zip code to this number. You get a list of vaccination sites near you. You click on the link, you're scheduled, right? You fill out some information and you're scheduled. So again, this is something people don't know, and this is the easiest way. So we do have, a website where you could sign up, or we have like a hotline that you can call. But the issue there is that when you're community canvassing and you're talking to the person real time, like you want to be able to sign them up then and there, and this is the best way to do so. Oftentimes when people sit there and dwell on it, they end up seeing a lot of misinformation on social media or the news, or like whatever it may be, a lot of fear mongering. They end up contemplating the conversation you had. So you want to be able to carry this with you when you're community canvassing or send this out. And then we also have like these social media graphics as well that you guys can post saying, hey, I'm a vaccine advocate. This is something I'm participating in. And then you could post this up and be like, hey, feel free to reach out. I am a vaccine advocate and I can go ahead and answer your questions for you. And then again, any of these graphics or anything you guys want me to add or include, feel free to reach out to me and I can go ahead and gear it more towards your specific community. This is the most important one. This entire month is dedicated to highlighting these three main points, basically, that vaccines are free of charge, they don't require any insurance. This is something people don't know, which is why they're so hesitant to take the vaccine. Another thing is that Uber and Lyft are offering free rides for this entire month. So this is this is trying to get people to understand how accessible it is, but also they end up not having any barriers to getting vaccinated. Another thing would be texting your zip code, like I had mentioned in the previous graphic. Like I'm saying, like a lot of people don't know how accessible it is. And this is that kind of information that we want to get out there, and we want to be able to let people know that our government and our community is doing their best to remove all barriers, and we want people to get vaccinated. And then we also have a myths and graphic slide. So what this basically is again, this is something that people are going to be asking when you're having these conversations. People are going to ask you questions like, are ingredients haram, right? Because we want to be able to gear it towards the Muslim community. So they're going to be asking you questions like this, or, you know, is it unsafe? Can it modify your DNA? Whatever it may be. We have fact-based research that you guys can utilize in those conversations. And that, again, makes you more comfortable and confident having those conversations. We want to give you those tools. So another thing, let's see. Here we have the texting script. And again, it doesn't have to be this word for word. You can go ahead and utilize whatever verbiage you'd like. But the biggest thing is we ask that you say text your zip code to this number. And then you'll have responses like, yes, we'll get vaccinated, already vaccinated. And then another thing is, will you volunteer your time? So this is a great way for also, if somebody says, yes, I'm vaccinated, or I don't, whatever it may be, you have the ability to say, hey, there's an incredible program we're doing for our community. Do you want to join in? So that's also like a great marketing tool for you as well. So if they have like a lot of questions, common responses for you would be over here. And then also you can guide them over to the madeTosave.org/learn website. And this is going to be, again, just reiterating all these facts. A lot of like frequently asked questions will be answered on that site. And if there's anything you are unsure of, you could send them over to this website as well. The canvassing script is very standard, similar to that of the texting one, but basically you have the option of calling a hotline. There's another number for Spanish speakers, or you could go onto the website as well. So again, there's a lot of accessibility, a lot of resources that you guys have as well to use. And if you guys have any issues or anything, you can go ahead and reach out to me as well. I will do my best to accommodate and help you guys along the way. And we'll also be meeting pretty frequently to kind of just discuss any barriers that you guys are having, or any issues, or sharing any success stories as well. I think that this is a really cool initiative, and I'm really happy that we have so many community members and so many Muslims taking that front line in vaccine advocacy, because we don't want our community to fall behind. We want to stay informed, we want to stay up to date, and we want to stay advocating for something like vaccines, because this is something that saves lives, and we don't want lack of information or misinformation to set us back. But aside from that, you guys all have my contact information. If you have any questions, I'm going to open up the floor to you guys. And then any resources you guys need, I can be that point of contact for you.